starting my first job as a registered nurse on a busy medical surgical unit. I'm not gonna lie, it was a rough start. I'm sorry I'm late. I took the wrong step.
Well, now that everyone's here, let's get started. In room 263, we have Mr. Tojam with a severe case of trichophyton dermatophytosis and a debilitating epidermodysplasia verruciformis. His vitals were stable overnight, but we were having trouble with infection in the lesions and currently running cefazolin Q8, acetaminophen PRN, dimenhydramine PRN, and a Verugon Q8. And the patient is scheduled for curettage at 10 a.m. Our next patient is in room 264 and is born with acromesomeliac dysplasia and is currently suffering from complications related to
I felt so underprepared and overwhelmed with morning report. What were all these new medications and conditions? The charge nurse talked so fast, and then... So, Mr. Tojam, how was your evening?
Ugh, terrible. Just terrible, I tell ya. I was coughing up lint all night. I barely got any sleep.
Oh, it sounds like you had a pretty rough evening. Let me quickly finish the assessment and then we can get the blood transfusion started.
Why am I getting blood? Hey, Stella, Mr. Crewlink needs that blood transfusion stat. Stella, room 263 needs you.
Oh.
Stella! Mr. Tojam is not even on your patient list. You should be getting that blood transfusion started on Mr. Crewlink.
Oh goodness, Mr. Tojam, I'm so sorry. I got you mixed up. I'll be right back. I mean, your nurse will be right back. Things just went from bad to worse.
Stella! How are you still charting? Room 263 needs you. What's going on here? Stella! Why are the physician orders not processed? What have you been doing this whole time? Don't you know how important it is to complete your documentation and charting in a timely fashion?
My basal
You're gonna have to learn to get it together, Stella. Nurse, I need you! Ah! Oh! My stomach is in knots!
Oh no! The dreaded knotted stomach! Whatever shall I do?
Oh, well, do something!
Hello there. My name is Nurse Angela. It looks like you could use some help in here. First things first, we're going to need to get that pain under control so we can untangle this mess.
Nurse Angela really saved my butt that day, and I learned some valuable lessons too.
Is everyone ready for morning report?
According to Blevins 2016, for the new nurse, it is helpful to take some extra time to get prepared in the morning. I decided to come in early and get my socks in a row. I also learned common conditions and medications on the unit. This helped me feel prepared and ready to go during morning report.
Based on work by Rush et al. In 2013, a considerate and patient-centered leader, like myself, will also make careful patient assignments and provide support to ensure that new nurses are not overwhelmed when they're starting out.
I now know the importance of doing a quick check at the start of shift to introduce myself and get to know my patients before I start the day. Once again, as Blevins 2016 and Karna's entry to practice competencies highlight, it is important to be organized. I found it helps me to write down information about my patients, their room numbers, and care priorities for the day. I also make sure to check my patient's ID band before I start care.
According to Hastings et al., 2016, best evidence shows that initial patient assessment, orientation, armband checks, bedside shift report, writing on patient whiteboards, and introducing yourself with name, occupation, and duty improves patient satisfaction. It also improves collaboration with care and reduces mix-up with care.
And according to PATH 2013, effective delegation can free time and tasks. Set out your care priorities early and collaborate with coworkers to make for a smooth flowing day.
Stella, darling! I have to say I'm so impressed with your charting these days. It's timely, comprehensive, and complete. How do you do it?
Well, with time and practice, I was improving my charting by becoming familiar with the electronic charting system. Also, by being organized and by charting interventions in a timely manner. According to Karna's entry to practice competencies, documenting in a timely and comprehensive manner is an essential skill for the transitioning RN. Furthermore, Sagafi highlights that effective documentation is vital to successful care in the critical care unit. Documentation maintains liability and prevents errors. Karna's entry to practice competencies and Blevins 2016 highlight that a prudent nurse, new or experienced, knows when to ask for help. In a scary situation, it is best to call in reinforcements. Hopefully, there is a nurse like Angela on your new unit.
Roman 2009 highlights the importance of finding a good mentor, someone who is wise and willing to support and teach the new nurse. Mentors embody the attributes of a superstar professional and are eager to share their knowledge and elevate new members of the team.
Also, as indicated by Rush 2013, supporting new nurses in their transition and creating a culture of mentorship leads to better health outcomes for our patients.
That's right, Hermilda. This is why we must all strive to create a culture of support for the new nurses.
Yo, I need some help over here.
Nowadays, I feel quite at home on Unit 585, as highlighted by theorists such as Dushner 2009 and Benner 1984. Developing competency as a registered nurse does not happen overnight, but requires dedicated practice and experience. To help me manage the workload of an experienced RN, I decided to be proactive in developing the organizational, time management, communication, delegation, and collaboration skills as outlined in Karna's entry to practice competencies. I also spent some late nights buffing up on my knowledge base to increase my confidence and improve my care plans. I worked hard to develop good relationships with my coworkers, and I'm glad to say I'm on Gramilda's good side these days.
Around the nursing desk, the odd call bell is.
And a debilitating epidermodysplasia verruciformis. His vitals.
Stella!
I lost my seat.
Well, hello there. Oh, your face!
It also improves collaboration. It's okay, it's not you. I'm the one talking.